I'm Dr. Anthony Harper here, blessed to talk with Larry Banta, who is a psychiatrist, to talk about some very key issues. And Larry, thanks for joining me today.
My pleasure.
I wanted for you to share with our listeners, kind of summarize your medical education and your work experience as a psychiatrist.
Well, I first trained in internal medicine, and then after a few years, I decided to go into psychiatry. And then I trained also in child psychiatry. After I completed my residency, I also then qualified for boards in neuropsychiatry, which is a specialty kind of between psychiatry and neurology, where I treat, this has been a bulk of my practice, treating all ages with neurologic conditions that have psychiatric manifestations, as well as treating the chronically and severely mentally ill for my whole career.
Okay. What are your training experience specifically in dealing with Parkinson's patients?
Many Parkinson's patients have mood disorder, psychosis, and other symptoms. And so I have had many Parkinson patients over the years that I have diagnosed and that have been diagnosed by neurologists and then referred to me because of their psychiatric symptoms that needed to be managed. And so I've had quite a bit of experience with the disease.
Okay. Well, what Parkinson's symptoms do you see in President Biden?
Well, from what I understand, he's had some tremor. He has rather inexpressive face, where you get kind of a blank face where it doesn't have a lot of expression. It's called a masked facies. And also his eye blink rate doesn't seem to be a normal amount. And, his gait has been a little unsteady. He's tripped and fallen a few times and seems to be kind of slowed down. Now, I could not diagnose him as having any particular neurologic illness or dementia without really sitting down and actually doing a full exam, movement disorder exam, as well as a cognitive exam to know exactly what might be affecting him. Does it appear that he's perfectly normal? No, there's something seems to be wrong with him for sure.
Well, those tests weren't completed by the White House physician. No reference to any cognitive test or full Parkinson's test as well.
Well, I think that many people have been calling for that, and including physicians that are in the Congress and Senate, that they want to see how he is really functioning. And I think Democrats as well as Republicans should know that is this guy okay to be a leader? Or are there problems? And I think those are very valid questions that need to be answered for us as voters, as well as for the leadership in the country.
Okay, you mentioned problems with movement in his face. Is that related to bradykinesia?
That's bradykinesia is a symptom of Parkinson's in which you have slowed down movements. You can have active tremor movements where you are shaking in a rhythmic manner. Usually one side is worse than the other, or one side may have the tremor and the other side doesn't have hardly anything. And then you have slowed down movements, which are the bradykinesia. The masked facies is not considered bradykinesia, but the movements, if they're slowed down, that's the bradykinesia.
Okay, like the expressions when he's talking, the way he speeches, his speech is slurred sometimes, and whatever.
Speech patterns that you find in Parkinson's, even if there's no dementia, you have sometimes word finding difficulties, and it's hard to start words that have hard consonants. So you may stutter or repeat the consonant over and over to get the word started. And I think we've seen that where he has some difficulty with some of the words. Now, he had been said to have stuttering as a child, and maybe, mixing that in there. I don't know whether this is part of disease process or stuttering that's maybe gotten worse over the years, but you do see speech patterns that might be questionable for certain.
Okay, you mentioned there's some Congress people that are physicians, specifically this Congressman Ronnie Jackson, who was the White House physician. Him and other congressmen calling for a cognitive test. They're saying that he has significant cognitive decline, and I know there are dementia can be part of Parkinson's. So, what forms of dementia can be related to Parkinson's?
So, Parkinson's disease itself does not always start with obvious cognitive impairment. Many people go for a long time without having much difficulty, but the kind of cognitive impairment you get without having actual dementia is some frontal lobe involvement where you have difficulty making decisions or become more obsessive or compulsive about things. And then later on in the disease, for almost everyone who has the disease, you'll get cognitive impairment and then maybe dementia. Some people start out with significant cognitive impairment and go into the dementia much quicker. Everybody's a little bit different.
Okay, what are your concerns overall about President Biden's physical and cognitive state?
From what I can observe in watching him in many speeches and only what we get through the media, basically, is that my concern is that he could very easily lack good decision-making capacity and be impulsive or not being able to really make decisions on the fly as you'd expect a president to do, slowed cognition, and things where we'd want somebody who is like on right on the ball exactly when something comes up to be reacting to it and doing meetings to develop plans and be able to direct the country as a leader and give everybody confidence. I am concerned that when things do come up, crises occur, that we're not having someone who is able to jump on it and have good decision-making capacity. That would be my, as a observer, not somebody that's working in Congress or anything, but as an observer, as a voter out here in the sticks, I am very concerned about how he functions.
Okay, I know there's some other really crucial issues that are in the news a lot about. Recently, the trans shooter in Nashville, Tennessee, LGBTQ issues. What is your medical, what is your training and experience working with LGBTQ plus patients?
I've had many patients in the lesbian and gay community over the years. And most recently, I've had quite a few people that are wanting to be trans. It has become a fad in the high schools, and the LGBT groups are very strong in the school to try to attract people into the groups. And once they're attracted in, it's very hard to leave. They're bullied, and this is experience from my own patients. So I'm telling what I know from this from the schools in our small community in Caldwell, Idaho, where I work, and that the trans movement is very, very strong. I think it was a very serious tragedy. The young person who was involved in the shooting, obviously disturbed. Obviously someone who needed mental health treatment, who did not get the treatment, who did not get the help that they needed. It's very, it's a very strong political movement. There are trans activists that are very much pushing their issues, and even some trans adults who see what's going on don't agree with what's going on with the trans activists and trying to push this on little children. And that the situation has become very dangerous.
Yeah, it is very troubling. I know that trans shooter's name is Audrey Hale, and even though she was born female, she identified male. Towards the end, I'm thinking about the use of testosterone and other or hormone and drugs. And what are your medical concerns about the use of hormone drugs and surgery and LGBTQ plus patients, especially in children?
Children and even adults, it's a really serious thing. First of all, you start these children if they want to, if they start to have this idea that they're not who God created them to be and want to change, they start hormone therapy very young, as before they're pubertal. And what happens is, if you are a girl and you start getting testosterone, it has lots of side effects. Over the years, you may have much more problem with heart disease and all other kinds of things with it, but it also can make you very violent when you're not supposed to be taking it. Maybe it's too much dose, or how you have a reaction to it. It can make you more violent. That's a consideration. But also, when these kids start the hormone therapy so young, it is very likely that they will be infertile. They will not be able to have children later on. Many children, according to a study in England, a very good research, they found that 85% of those who chose to try to change their gender as adolescents, by the time they were 25, wanted to change back. And so this is a very serious decision they're making. I try to encourage my adolescent patients not to make this decision. It comes from just not really having that foundation in God's word, where it says God created them male and female, and God created the marriage bond between the male and female, where sexuality occurs only there. And this is the foundation that we are to be built on. And when we don't have that foundation, we don't have those rules in our head, in our mind, we've become God. We decide that we're God, and we are going to make the decision of who we are and what we want to be and what we want to do. And there are no rules, basically, if you don't have that foundation in God's word. And so you end up very confused. These are very confused children. Many of the children that I see are on the autism spectrum. They're very easily pulled in. They're already ostracized because of being a little different than the other kids in the school, and maybe bullied and that. And then they get pulled into this idea that, hey, you like girl things, maybe you're really a girl and you're a boy, or vice versa. And then they start thinking, well, I can belong to this group and I'll be accepted. And they are kind of accepted, but if they choose to leave, I don't think I really want to change, I really like being a boy, and then they're very much ostracized and bullied, and you are really forced to do it. So you say, for example, oh, I'm confused, I don't know what I want to do. So they send you to the counselor at school, and the counselor is going to say, okay, well, let's work on a transition. Let's get you some help. We'll get you to a counselor to help you change from a boy into a girl, or a girl into a boy. There is no help from, and even they're trying to tell counselors it's unethical to help a child make a decision to do the right thing. The right thing being staying in what gender God created you in. And the counselors feel obligated by pressure and by society that if a child has that confusion, they need to go on into the transition. And it's almost like converting, like someone is converting to a religion. I got a new person who wants to transition, and so here you go, and you work with them to make that transition, and you give them clothes to wear at school, and it is so destructive to these kids, physically destructive, because the hormones are change your body, and then many of these children are making the decision to have either top surgery or bottom surgery, they call it, and change the appearance, mutilate their bodies to become looking like a boy or a girl when that is not who they are. And those changes are irreversible. You may be able to get some implants for the breast later on when you decide, as many people have, they want to come back and be who God created them to be. And now they got to go through surgery to try to correct it. They will never be able to nurse a child. Of course, with the males, they remove the external genitalia and they leave a little bit of it for pleasure. And the surgery is extremely mutilating. I spoke to an elderly person just the other day who was a Christian, and he decided that he wanted to be a girl, and now he was kicked out of the nursing home because he got upset about wanting to go back to who he was. And I saw him briefly in consultation. I said, no, he's fine. He wants to go back and be a guy. Let him. I'll stop the hormones. We'll get him back to what he wants to be. But he already had the surgery, and the decision he made was just torturing him terribly, and that he'd made so long ago. And these kind of decisions are, even for adults, are really difficult. But kids, we don't even, let them choose their clothes sometimes. We want them to wear certain things, and here they're, they can't get a tattoo. They can't have other kinds of surgery, and here children are deciding in many places that this is what they're going to have done. And then the laws are in their favor and the favor of those people who want to get this surgery done. And they can even be taken away from their parents. And so this is becoming a extremely important issue that needs a lot of prayer and a lot of people on the side of defending these children against being mutilated. It's a very difficult situation.
It is. What is a gender dysphoria, and your medical opinion of patients diagnosed with that?
Well, gender dysphoria is defined as having a strong desire or sense that if I'm a boy, that really I'm in a girl's body. And I feel like I need to be a girl. And many times in the past, before there was so much push on becoming trans, these individuals might have cross-dressed or might have been involved in the drag movement, those kind of things, where they are able to dress as a woman and act as a woman and do these things. And basically, it's that sense initially that I'm not really a boy, I'm really a girl, and then, or vice versa. And then that almost, in a sense, becomes delusional. A delusion is a fixed false belief that is not altered by truth or data. Excuse me. And it becomes a delusion that I'm really a boy or I'm really a girl. And this delusion becomes more and more difficult to dissuade. And I really, really want to change into a boy. I really want to change into a girl. And that's really what gender dysphoria is. In the past, we worked with these kids to help them see that, yeah, you have a feminine side or you have a masculine side, and you are able to use that effectively. But really, you are who God created you to be. And let's keep going that direction. I had a physician come to me many years ago who was cross-dressing at night, going out and having a really rough time with it. And I had him in therapy for a couple of years to get him back to what he needed to be. And he was able to give up those temptations and live as a man and in God's sight. And for him, it was such a relief to give up those those beliefs and be able to have truth about who he really was. But it took a long time in therapy to work with him. He had the desire to change. And that's the whole thing. If you have a desire to change, this is a belief system you don't want to have in your mind. Therapy, Christian counseling and therapy can help you get back on track using the basis of God's word and the love that God has for us, and understanding that we have these temptations. And these are many times, as a child or adult goes on, they are more of a temptation that we need to deal with. It's wrong. Just like having sex outside of a marriage is wrong. Like homosexuality is a sin in God's eyes, the same way that extramarital sex is a sin. We work with the temptations, and we work with trying to overcome that. And with God's help, we can.
The transgender issues are so in the news, especially with regard to drag queens in the libraries and boys in girls' bathrooms and sports. What is your comment about those things that are happening?
This is kind of, we've already seen that this is a tragedy where the boys in the sports have injured the girls so badly, such as the volleyball situation in one school, and the champion swimmer with Riley Gaines, who was in second place, with a male having won the championship. It's destroying women's sports. Basically, women's sports are not going to be the same if they keep this up. And also, it's already been shown to be dangerous that these boys are going into the girls' locker rooms and restrooms and assaulting them. And this is what's going to keep happening. Girls are not going to feel safe. I don't understand how, over the years that I've been around, which is a few, women's rights was a big deal. I really supported women's rights. I mean, I wanted them to have their own say in things and be recognized. And well, they got voting, they got all these things done. It was wonderful. And now it seems that they don't have rights anymore. It's being overtaken by the trans movement, so that women in sports, which Title IX was so good in promoting women's sports and allowing them to compete against women and show their prowess amongst their peers and be recognized. And what could be better than that? And now they can't be recognized. Now it's all going to be men again taking over, who are dressed like women. And this is a sad situation. It's going to get worse, and unless people stand up for it, like many people are. Every time this is brought up in a school in our area, there are thousands of people that come to the meetings and try to dissuade the school boards and try to get them to be sensible about these things. And it's a big battle, and it's going to continue to be quite a battle.
And there's an issue of homosexuality in general, and with regard to homosexual being removed from the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders. How did that come about?
Well, that's a very interesting story. There had always been a consideration as to whether this is a disorder or what it might be. 1969, it started to become more of a political issue as the gay rights movement began to protest outside of the American Psychiatric Association meetings. Then they started to have more research into it, and then there was this research from Kinsey, which was very flawed. Everybody knew it was flawed, saying that 10% of the population was gay, and he had basically been using a prison population for his studies, which was not general population. And using those studies, everybody thought, well, this is a common thing. But in fact, it was the vote in the American Psychiatric Association was 58% to remove it, and 42% of us, I wasn't a member yet at that time, 42% were still against it. So it wasn't a unanimous decision to remove it. As a disorder, I thought about it myself, whether, should you have it as a disorder? Well, some people are not content with being gay. They don't want to have those thoughts. It's a temptation they want to overcome. For those people, it's not, it is a disorder, and they want help. Can they get help? It's very difficult, because as therapists, we are really not supposed to be involved in what they call change therapy or anything like that. But these people have a desire to not be like they are, and they need help to get out of it. There's many organizations that do help. They keep themselves pretty secret. I worked with one in the early 90s called Exodus International. They became part of our nonprofit group at that time. And we were working closely with them. And they actually took over the nonprofit I had that was for a counseling center. And they went on to work with them, but they do it quite secretly. They don't have any, they want to make sure that people don't know about it, basically. Just the people that need them. Should it be a disorder? I don't know. I think it's probably more a lifestyle choice. You have decided to go along with those temptations and live that way, and you're happy with it. Not everybody is, but some people are, and so I think it's a lifestyle choice more than anything else, except for those that are distressed by it.
Yeah, you mentioned it was maybe considered unethical for therapists to be involved with change therapy or influencing that. But yet, as you also mentioned about, there are therapists that are trying to encourage children to change. I mean, supporting them in using these hormone drugs and the surgery.
Yeah, this is a very sad situation when you are pushing the agenda. And a lot of times it's like these kids, like one kid that I was talking to, a young girl that wanted to be a boy. And I told her, there are risks to what you're choosing to do. The hormones have risks. Making these changes have risks. A lot of people don't want to stay this way. And she just yelled back at me and says, I don't have a choice. It's like, oh my, this is the mindset that they're put in. I don't have a choice. They're almost like brainwashed into this thing where I need to change. I'm not a girl, I'm really a boy. And she was very feminine when I first started working with her and other issues. And she left me ultimately because she wanted a therapist that would support her decision. And that's where kids are going. And it's sad, it's tragic.
Yes, I understand. There's so serious issues that are affecting our society, our world. And how would you say the removal of homosexuality from the DSM played a role in normalizing homosexuality?
I think it really did, because, it was no longer considered something outside the quote norm. And then they were able to really push their agenda on the rest of us, which is, there are radical gays, and there are gays who are just, they live their life. They don't bother anybody. They're fine. I work with people that are like that, and but then there are people who really want to change children into being gay. There is a I've read in in some of the literature where um, there was movement to really pull kids into the gay movement by by accepting pedophilia, by accepting the man and boy love kind of thing, and then this will help pull them into that society. There's a push to make pedophilia not a disorder, to make it what were they calling it, the minor attracted persons, MAPs. They want to add that to the initials, the LGBT and the MAPs, and it all becomes such a mess, such a horrible thing.
Yes, very emotional, and for a lot of parents who are really concerned about what their children are experiencing in school, and in these so-called therapy sessions. I know that you've written a couple books, and so for our viewers, what are those books? Where can they get them?
Well, the one book I have about children is called "Help for the Hurting Child." This one is about working with foster and adoptive kids, but also helping kids to grow up in a good environment, having good structure in the home. The other book is called Help for the Hurting Family. And this is a book that I feel needs to be in every home library, every church. I've been giving it free to pastors who I meet as I go around doing talks. It's about building families in a chaotic world, building strong families. And it starts out with how to structure your family, how to what our roles are as man and woman, some issues about raising children in this world, and helping them become independent and on their own, sexuality education for the kids, which is very important. And then also, in the second part of the book, talks about problems that we face as families, the real problems such as divorce, drug abuse, mental illness, a big chapter on mental illness, dementia, caregiving, and then being able to finish strong in spite of all the storms of life, to be able to get through life and to keep on standing on the foundation of the Word of God. It starts out with building the foundation on the Word of God. And I think this is something that families can really benefit from. Both are available through Amazon, Barnes and Noble, and the Help for the Hurting Family is also on the Christian book, the CBD, Christian Book Distributors.
Okay, well, thank you for sharing those important topics today. And for people that want to know more about your experiences, do you have a website at this point, or?
I have a website for the books. I have helpforthehurtingfamily.com, which will eventually have a blog. And then I'm also on Facebook. They can find me on there, in Lawrence Banta, MD. I have a Facebook page. That's my book Facebook page. And I can be contacted through Facebook. It's probably the easiest way. And then for speaking engagements and that, I'll be available throughout. We're traveling quite a bit in the fall, and the speaking dates are filling up. So we'd love to come to church or groups to talk about building families and about mental health.
Well, thank you, Dr. Banta, for joining me.
You're very welcome. It's been a pleasure.
Thank you.